The topic of my presentation is menstrual cycle. Menstrual cycle is the process of discharge of blood and other things from the vagina of a woman every month from puberty to menopause, excluding pregnancy. It is a natural periodical process that brings changes in the female reproductive system, which is responsible for pregnancy. It includes changes that occur in the ovary and uterine wall simultaneously as a result of changes in the level of hormone in the blood. Two significant events occur within the female reproductive organ. First is the release of a single ovum from one of the ovaries, and the second is that the uterine endothelium is prepared for the plantation of a fertilized ovum. If the ovum is not fertilized, the lining is released, which result in menstruation. The duration of the cycle average about 28 days. Hormones involved in the menstrual cycle. The hypothalamus secretes a luteinizing hormone secreting hormone which stimulate the anterior part of the pituitary to secrete follicle stimulating hormone. FSH causes the maturation of ovarian follicles and stimulate the release of estrogen, which is responsible for ovulation. Next one is luteinizing hormone LH, which triggers ovulation and formation of corpus luteum and release of progesterone. Hormones released in the cycle are stimulated by a negative feedback mechanism. The hypothalamus is stimulated when the level of estrogen and progesterone is low in blood and is switched off when their concentration is high. The menstrual cycle is described by ovarian and uterine cycles. The ovarian cycle involves the formation and maturation of follicular cells in the ovary, whereas the uterine cycle describes the changes in the endothelial layer of uterus. The cycle is divided into three phases. First one is follicular phase. After puberty, as a result of release of large amount of FSH and LH by the pituitary, the ovaries with the follicles start to grow. Under the influence of FSH, these cells develop layer of granulosa cells as well as express the LH receptors on the granulosa cells. The second layer of cells called theca develops around these follicles, which can produce other sex hormone like estrogen and progesterone. After a week or more of growth, one of the follicles start outgrowing other follicle, a process called atresia. The single follicle further increases in size and form the mature follicle. Ovulation phase. Ovulation in women with regular 28 days of sexual cycle occurs 14 days after the onset of menstruation. The secondary oocyte then reaches the fallopian tube through the fimbriae. If a sperm fertilizes the oocyte, it develops into a mature ovum. If fertilization doesn't occur, the secondary oocyte degenerates within the fallopian tube. Then comes luteal phase. Luteal phase is the last phase of the ovarian cycle and it corresponds with the secretory phase of the uterine cycle. Corpus luteum produces progesterone that inhibit the release of FSH and LH by the pituitary. Consequently, concentration of FSH and LH falls over time and the corpus luteum degenerate. The falling level of progesterone then trigger menstruation. In the case of a successful pregnancy, the degeneration of corpus luteum is prevented by release of human chronic gonadotropin HCG from the placenta. Corpus luteum is essential to produce progesterone which maintain the new pregnancy. Uterine cycle. The uterine cycle includes the changes in the endothelial layer of the uterus. It is divided into three phases. Menstruation, also called menses, menstrual bleeding or a period, is the first phase of uterine cycle. This occurs as a result of degeneration of corpus luteum, which inhibits the release of FSH and LH from pituitary and thus prevent the proliferation of other follicular cells. The menstrual flow consists of blood from broken capillaries, secretion from endometrial glands, endometrial cells as well as unfertilized ovum. This phase usually lasts about 3 to 5 days but might range from 2 to 7 days in some women. On average, 35 milliliter of blood is lost during menstruation. Then comes proliferative phase. This is the second phase of uterine cycle where the estrogen causes the proliferation of the endometrial layer in the uterus. After the maturation of follicle in ovary, they cause the release of estrogen, which causes the growth of a new layer of endometrium called proliferative endometrium. The endometrium becomes thick with the rapid cell multiplication and increases the mucus producing cell as well as blood capillaries. Then comes secretive phase. The final phase of the uterine cycle corresponds with the luteal phase of ovarian cycle which occurs after ovulation. The corpus luteum releases progesterone hormone which is particularly essential to make the uterus receptive for the implantation of fertilized ovum. If fertilization occurs, fertilized ovum travel to the uterus through the uterine tube and become embedded. However, if fertilization doesn't occur, menstruation occurs and a new cycle is initiated. With this, I end up my presentation. Thank you.